Hello everyone, welcome to this lecture. My name is Daniel Munane. I am an urban mobility and street design assistant at UN Habitat based in Nairobi, Kenya. I will be taking you through the lecture on the 5 pillars and recommended actions for Africa. This lecture is a third chapter of the foundation courses of the Transafe e-learning program. In the previous lecture, you got an introduction to the safe system approach and learned about the global plan for road safety. In this lecture, we delve deeper into the 5 pillars of the safe system approach, highlighting some recommended actions for each pillar in the African context and some examples of the safe system approach in action in Africa. We will end this lecture with a reflection exercise. Let's get into the lecture. I hope you enjoy. A brief introduction. There are 5 pillars of road safety in the safe system approach, and they include multimodal transport and land use planning, safe road infrastructure, safer vehicles, safe road use, and post-crash response. The first pillar we get to look at is multimodal transport and land use planning. About 60% of the global population is expected to live in urban settings by 2030. This means demand for mobility will exceed the capacity of most current systems in these areas. This pillar is an important first step to implementing the safe systems approach. It determines the optimal mix of motorized and unmotorized transportation modes to promote safety and equitable access to mobility while catering to a population's different needs. It should always be tailored based on the local context and climate. Land use planning should take into account 3 things. 1. Travel demand. 2. Mode selection. And 3. Provision of safe and sustainable journeys for all, especially for sustainable modes like walking, cycling, and public transport. Land use planning should be followed by standards that strictly avoid or mitigate potential road safety risks and require minimum safety performance for all modes and abilities. For example, the availability of parking for bicycles and private vehicles at bus stops and train stations can facilitate multimodal commutes, eliminating risks to pedestrian and cyclists from motor vehicle traffic. What other examples come in mind concerning this pillar? The recommended actions under this pillar include 1. Promote compact urban design. 2. Implement policies that lower speeds and prioritize the needs of pedestrians, cyclists, and public transport users. 3. Promote transit-oriented development, encouraging urban and commercial development around transit modes. 4. Discourage the use of private vehicles in high-density urban areas. 5. Construct or reconstruct transport networks, ensuring that active modes of travel are as safe as motorized modes and meet the travel demands of all ages and abilities. And lastly, provide intermodal connectivity between transit and bike share systems at key transit stops and provide transport connections for bicycle and pedestrian travel that reduce total travel time. Multimodal transport in action. So, in Addis Ababa, the public transport in Addis was termed unsafe to access. Guided by the Addis Ababa and Oromia Special Zone Integrated Development Plan 2014 to 2038, backed by additional transport strategies, plans have been made for the construction of BRT in Addis, as well as the extension of the existing light rail transit. Although gaps in implementation has slowed down impact, accessibility and connectivity has been seen to improve, with 56.1% of residents taking the LRT to work, and connectivity has been extended to community hubs like the Mercato Market. This has been made possible through multimodal transport planning and land use planning. Easy access and connectivity has improved the safety of the residents due to reduced distance to access the public transport system. The next pillar is safe road infrastructure. Safe road infrastructure is important for safety. Road infrastructure should be designed and operated in a manner that reduces or eliminates risks for all road users. In addition to this, road infrastructure should be planned, designed, built, and operated to support multimodal transport, that is, public transport, walking, and cycling. Minimum technical infrastructure standards are required and are necessary for all road users, including pedestrians, cyclists, motorcyclists, car occupants, public transportation users, freight operators, and other road users. These standards should include features like sidewalks, safe crossings, cycle paths, motorcycle lanes, bus lanes, safe roadsides, segregation of different modes of traffic, median separation of high-speed traffic, safe intersection design, and speed management suitable for the location, desired amenity, and type of traffic. The image on your screen shows some of these features. In order to maintain the safety of all road users, logical and intuitive infrastructure design should be used for speed management. This could include intersections, designing intersections with features that reduce the likelihood of conflicts and collisions, such as dedicated turn lanes and signal timing. The recommended actions under this pillar include 1. Develop classifications and desired safety performance standards for each road user group at the geographic, land use, and road corridor level. 2. Review and update legislation and local design standards that consider road function and the needs of all road users and for specific zones. 3. Specify a technical standard and star rating target for all designs linked to each road user and the desired safety performance standard at that location. For example, some countries use the International Road Assessment Program, IRAP, star ratings. 4. Implement infrastructure treatments that ensure logical and intuitive compliance with the desired speed environment. For example, having a speed of 30 kilometers per hour in urban areas and having a speed of 100 kilometers per hour on expressways. 5. Undertake road safety audits on all sections of new roads and complete assessments using independent and accredited experts. Dar es Salaam Bus Rapid Transit, also known as DART, is a good example of safe road infrastructure. This BRT is planned, designed, built, and operated to support multimodal transport. The system is integrated with cycle paths, sidewalks, and improved pedestrian safety with well-designed at-grade pedestrian crossings, also complying with universal accessibility principles. The road infrastructure also includes segregation of different modes of traffic, median separation of motorist traffic, and safe intersection design. The next pillar is safe vehicles. According to the recent WHO Global Status Report on Road Safety 2023, the world's motor vehicle fleet is currently exceeding 1 billion vehicles and is likely to double between this time and 2030. Despite this growth, many new vehicles that are being produced and sold do not meet minimum safety standards. Vehicles should be designed to protect both those inside and outside them. Different features can be implemented into vehicle design to increase vehicle safety, either to avoid crashes or to lessen the risk of injury for occupants and other road users when a crash happens. Although various types of technological solutions have been developed around the world, there is a need for harmonized regulatory standards for vehicle design and technology. There are two types of regulations required to ensure vehicle safety. The first one is legislation that specifies equipment requirements and standards, and the second one is legislation that governs inspections or assessments. Additionally, agreements on UN vehicle regulations have been formed to assist countries in developing regulations to provide and enforce safety standards in the production of vehicles and their parts, as well as periodic technical inspections throughout their lifetime. Once standards are mandated, it is necessary to guarantee that they are integrated into and maintained throughout the vehicle's entire life cycle. The recommended actions under this pillar include 1. Ensure high quality harmonized safety standards for new and used motor vehicles, safety belts, child restraint systems, and motorcycle helmets. This includes standards on electronic stability, control to prevent skidding and loss of control in cases of oversteering or understeering, advanced emergency braking to reduce collisions, and many more. 2. Ensure that high quality, harmonized safety standards are kept throughout the full life cycle of the vehicle. This can be achieved through, for example, mandatory certification and registration systems for new and used vehicles based on established safety requirements and combined with routine inspections. Safe vehicles in action. With the African vehicle fleet set to grow 4 to 5 times by 2050, the impacts on road safety are bound to rise exponentially. Estimates have been made that about 80 to 90% of this growth will come from the import of used vehicles. However, a significant number of these imported used vehicles do not meet safety standards. The Safe and Cleaner Used Vehicles for Africa project, led by UNEP and UNECE, seek to shift the paradigm on the used vehicle trade through putting in place regulations, standards, and processes to ensure that Africa will only receive quality used vehicles which will have major road safety benefits for both car drivers, road users, and co-benefits on the environment and economy. Guidelines have been developed to support African countries on used vehicle inspection and monitoring framework, compliance and enforcement mechanisms, and information sharing systems, and also best practices, procedures, and requirements for exporting and importing countries have been reviewed. The next pillar is safe road use. This pillar focuses on road user behavior. Speeding, drink driving, driver wariness, distracted driving, and failure to use safety belts, child restraints, and helmets are just a few of the important behaviors that contribute to road injuries and fatalities. According to the WHO Global Status on Road Safety Report 2023, 10% of road traffic deaths were related to drink driving from the data collected. It is therefore important that the design and operation of the road transport system takes these behaviors into account through a combination of regulation, enforcement, and education. The risks brought about by road user behavior can be mitigated through the adaptation and implementation of appropriate legislation. Although many countries have such laws, those laws do not always meet WHO best practice and are not consistently implemented through regulations or enforced. Road user behavior is also heavily influenced by vehicle safety features and road infrastructure design, which should take into account the needs of all road users. The recommended actions include 1. Enact and enforce road safety legislation, for example, the use of protective equipment like safety belts, child restraints, and helmets. Another example, restrict the use of handheld electronic devices while driving. 2. Establish traffic rules and licensing requirements. For example, set out and regularly update traffic rules and codes of conduct for road users. Another example, provide information and education on traffic rules. 3. Ensure inclusive road design which fosters safe behaviors. For example, clear road signage and road markings that are intuitive. Another example, use of roundabouts and traffic calming designs such as speed humps. 4. Use vehicle innovations to support safe behaviors. For example, automatic safety belts and seat belt alerts, intelligent speed assistance, technologies to disable texting and or other forms of distraction while driving. Motorcycle helmet enforcement in Kigali provides a good example of enacting and enforcing road safety legislations. Motorcycles are seen to be a menace in most East African countries, but not for Rwanda. The motorcycle sector in Kigali is governed through over 18 formed cooperatives. The cooperatives work hand in hand with traffic police to enforce discipline and law. The last pillar is post-crash care. The delays in minutes make the difference between life and death, making post-crash care extremely timely, sensitive, and crucial. Once a crash occurs, appropriate, integrated, and coordinated care should be provided as soon as possible. Procedures for ensuring appropriate action include an alert system, like a universal access call number like 911. Question: does your city have an alert system? Such systems are linked to relevant professionals who are in turn able to quickly dispatch appropriate emergency services with trained personnel and the necessary equipment through ambulances or sometimes helicopters when needed. Community first responder training should be promoted to substantially increase timely access to simple, life-saving interventions. This should be done in cases where pre-hospital services are limited and/or response times are long. Some recommended fast responders include police and firefighters and others whose occupations frequently put them at the scene of road traffic crashes, like professional drivers including taxi drivers and public transport drivers. Rehabilitation is also an important component of post-crash response and care systems since it can significantly minimize lifelong disability among people injured in a road traffic crash. Adequate support systems for crash victims and their families should also be put in place. This can be achieved through governments developing mechanisms to provide multidisciplinary crash investigation to ensure justice and provision of financial and social support to victims and their families if needed, to ensure that they are not pushed into poverty because of the large costs associated with prolonged treatment and rehabilitation. The recommended actions under this pillar include 1. Establish a system to activate post-crash response. For example, a unique emergency telephone number with national coverage. Another example, coordination mechanism for dispatching response, like fire brigade, police ambulance. 2. Build the response capacity among lay responders. For example, provide basic training for lay providers such as taxi and public transport providers, police, fire brigade, and many more. 3. Build up professional medical care. For example, establish trauma registries in healthcare facilities to gather information on the cause of injury and clinical interventions. Another example, build capacity or pre-hospital and rehabilitation care services and establish a basic package of emergency care services for each level of the health system. 4. Establish multidisciplinary needs for post-crash investigations. For example, establish coordination mechanisms for post-crash investigation and sharing of data by relevant sectors. Lastly, provide bereaved families and survivors with social, judicial, and when appropriate, financial support. A good example of the post-crash response in action are initiatives in Nigeria. The initiatives include emergency ambulance centers and road traffic crash clinics. The emergency ambulance centers were initiated in 2009 around the country's capital. The centers were named Zebra, and there was an emergency number and toll-free line used for prompt crash response. Nigeria also established road traffic crash clinics, which were also developed along major highways in Nigeria, simultaneous with the development of the ambulance service system. The clinics did not only care for road crash victims, but also benefit victims of other sorts of accidents and diseases. We have looked at all the 5 pillars. As you get to reflect on this lecture, here is a simple exercise that will help you through it. You can pause the video and think about your answer. We have come to the end of this lecture. Here are some references and additional reading material. For more videos on road safety, you can always check out our website at www.transafe.org. That's it for this lecture. I hope you learned and enjoyed the lecture. Thank you for listening to this lecture. See you in the next one. Bye-bye.